Meanwhile, South Africa has temporarily halted the rollout of AstraZeneca coronavirus vaccines after a study showed that the dose provided minimal protection against the COVID variant found in the country. The government said that it has been awaiting reports from scientists on how to proceed further. Earlier, a locally conducted trial showed that the vaccine failed to provide enough protection against mild to moderate infections caused by the South African variant. The country was set to roll out the shot today, and healthcare workers were first in line to receive the jab. South Africa has received over 1 million doses of the vaccine, which has been developed by a UK firm. Authorities said that the temporary suspension of the AstraZeneca jab will not affect the country's inoculation drive, which is set to begin today. The government will offer the Johnson and Pfizer vaccines to its population, while experts decide how the AstraZeneca shot can be deployed. Researchers are planning to carry out large-scale trials to get more data on the jab's efficacy. More than 2,000 young and healthy volunteers participated in the trials. However, the South African COVID Advisory Committee says that the trial data is not enough to determine the vaccine's efficacy. The body is planning to conduct another study involving more participants. Bolivia is battling a fierce second wave of COVID-19 infections, so much so that funeral homes and cemeteries are overwhelmed. As corpses pile up, the grim reality of Bolivia's health crisis emerges. Here's a report.
Bodies wrapped in blankets and plastic bags lying on the ground. Corpses piling up. Bolivia's funeral homes and cemeteries are overwhelmed, and a grim reality is now coming to light, exposing the cracks in the country's governance and healthcare system. A second wave of COVID-19 infections has gripped Bolivia. Funeral homes in the capital La Paz, the hardest hit region, are at capacity. The growing backlog could become another focal point of infections.
Lamentable, porque se están constituyendo en focos de infección toda vez que hemos encontrado cadáveres en los pisos, en mesas, han habilitado patios traseros, garajes, habitaciones como depósito de cadáveres con COVID, sin ninguna medida de bioseguridad.
These scenes are hard to watch. Corpses lie strewn across the floors of garages. Some are spread across hallways of funeral homes. Fingers are being pointed at funeral home owners, accusing them of hoping to profit from the recent spike in COVID-related deaths.
Los gobiernos departamentales que estaban encargados de dar capacitación a las funerarias para el manejo de cadáveres COVID no lo han hecho. Segundo, porque los empresarios dueños de las funerarias han visto una forma de lucrar con el tema de los cadáveres fallecidos por COVID.
Similar scenes can be witnessed in El Alto, Bolivia's second largest city. The crisis is so grave that cemeteries have stopped accepting bodies of COVID-19 victims. The country has recorded some 225,910 COVID-19 related cases and more than 10,000 related deaths. And January has been recorded as the second deadliest month since the outbreak began.
Se han registrado en este mes de enero 1,214 muertos, ¿no? Pero el registro del Servicio de Registro Cívico Oficial de Bolivia ha registrado un total de 9,126. Eso significa que, en base a la proyección de muertes que debería haber habido en enero sin una pandemia,
Bolivia happens to be among South America's poorest countries. The pandemic has overwhelmed the healthcare system. The country recently received its first batch of Russia's COVID-19 vaccine, Sputnik. But even then, it will be some time before these grim scenes fade away. Bureau Report, WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.